many by developing professional norm or heuristic. Professional norm and therefore the heuristic and behaviors of professional can be strongly influenced by respected leaders. They are therefore often of a local nature and may result in small area variations. Doctors also display non-standard beliefs. A survey in Chicago showed that doctors are often too optimistic in their predictions of patient survival, especially when communicating with the patient and their relative. Interestingly, the authors succeeded in incorporating their survey into the administrative form, which a doctor had to complete anyway when diagnosing a patient. Ignorance et al. Focus on the difficulties that patients, medical journalists, and doctors have in understanding and communicating probabilities. Patients and medical journalists in general are statistically illiterate, and serious consequences may emerge if the doctors cannot communicate the pros and cons of different treatment. We end this overview with three recent developments in behavioral economics. Conflicts of interest (COI) has been addressed by Danners and Lowenstein, with conflict between professional interest and financial incentive in the USA as an example. Such conflicts are often accompanied by an unconscious self-serving bias, and at the moment we do not know how to address this. According to Dyer and Lowenstein, the policies in use are based on assumption that COI is a deliberate choice and the efficiency of the policy is consequently doubtful. One way to affect health behaviors is to nudge. Better knowledge about people decision making will enable the development of policy intended to maximize chances in the decision situations. That is, to push people in a certain direction in their decision making. Typical examples of health-related nudges are serving alcohol in smaller glasses and making carrots the default side order instead of chief. A middle ground between the behavioral and neuroclassical views of individual decision making is a dual process approach. Two systems are at work when we decide: the intuitive system and the analytical system. In our everyday decisions, the intuitive system is at work, and in uncommon strategic situations, the analytical system takes over. However, the latter does not always happen. When the intuitive system is used for decisions that actually demand more analytical reasoning, biases might result. Cross-Carries 2009 presents a dual process model of data decision making, which covers all steps in the extent to which intuitive and analytical reasoning operate at the different stages. According to Cross-Carries, pattern recognition connects the two types of reasoning. 2.2 Experimental Economy. Health economics were prominent in the famous large-scale RAND health insurance experiment that took place roughly 40 years ago. Today, a very popular class of experiments among health economics is data reference experiment, especially so-called discrete trial experiments, which are often performed to educate the willingness to pay of the participant in relation to a certain good. Such experiments are presumably well known to most readers of this journal. Here we will focus on two other types of experiments. The first type is the incentivized reviewing preference experiment. The second is experiment focusing on the judgment and decision-making phases preceding the actual choice of the participant. We currently have a much more dynamic view of experiment than one expressed in the well-known Handbook of Experimental Economics by Carroll and Roth. The purpose of characterizations by Harrison and List is a good starting point, although, as this author notes, any taxonomies in the developing area should be used in caution. The article is ostensibly about few experiments, but in practice it covers more than that. To Harrison and List, a conventional laboratory experiments is characterized by subject pool of students, a strict bounding and imposed as rule. In an artificial field experiment, a non-standard subject pool is added. In a fair field experiment, a field concept is added. In a natural field experiment, the decision environment is familiar to participants to the extent that they are unaware that they are participating in an experiment. Harrison and List also describe a social experiment as the evaluation of governmental agency through initiated variations in their policies, such as the RAND experiment mentioned above, and a natural experiment as the observations of a naturally occurring control comparison. In a recent reflection on the experimental method in economics, Barclay et al. Criticized the characterizations of Harrison and List, especially in relation to the issue of external validities, i.e., to what extent the results of an experiment can be generalized. More specifically, they criticize the tendency of Harrison and List to apply a too strict model-like view of the interventions in experimental design. Instead, they encourage readers interested in the issue of external validities of experiment to think outside the rather limited box of currently standard design. The issue of external validities as well as internal validities, together with the issue regarding the role of decisions and the use of monetary incentives in experiment in part of a reference and ongoing methodological discussions in experimental economics. The reader should note that according to Harrison and List, financial incentives are not a necessary part of an experiment. In practice, however, financial incentives have largely been viewed as a mandatory part of this type of experiment. Following Barclay's, we describe typical laboratory experiments as incentivized reviewing preference experiments. That is typical laboratory experiments, including strategy game, use an incentivized setting for their experiments and collect data of the actual choices made by the participant of the experiment. The second experiment type we highlight is experiments that target the judgment and decision-making phases. They are closely related to the experimental procedures of cognitive psychology. Compared to incentivized reward-driven experience, their structure is less formal, and the concept often less control. Financial incentives are not necessary if they are not of specific interest, and even deception is sometimes used. These differences in experimental procedure probably harken from the different view on theory building between cognitive psychologists and neoclassical economists. Some health economists may be surprised to hear that incentivized review preferences studies do not necessarily involve a representative participant pool and see no problem in relying on only students as participants. It depends on the purpose of the experiment and a goal by fund enhancement. For the purpose of testing theories, this is not a problem because most of economic models provide predictions that are independent of assumptions concerning the participant tool. On the other hand, if the purpose is to directly address the economic realities, representativeness